without funding. Even just the slightest movement you have to make, you need transportation and all whatnot. And for organizations, for individuals, in order to move this agenda, they need to have the skills. And that is why capacity is going to be very, very important in all what we are going to do. So we are going to quickly move to the next point on our agenda, which is opening remarks from the chairman of the AMHROA Board of Trustees, Prof. Ovindo James Taiwo. Please let's put some hands on the chat to welcome Prof. I hope Prof is around. From the chairman of the AMHROA Board of Trustees, Prof. Ovindo James Taiwo. Please let's put some hands. Please, it's Prof around. Prof. I hope Prof is around.
Yeah, he's having some difficulties connecting. He's on transit. He will be joining us very soon. But we can take the presentation from the country reps that are on ground.
Okay, great, sir. So let's just quickly move to Nigeria. That is first on the agenda to talk to us about the mental health reforms and care progress in Nigeria, the challenges they are facing, and some advocacy highlights or directives we can take in this accelerated program. So the country representative for Nigeria, the floor is yours. Nigeria, the challenges they are facing, and
I want to be a little bit biased, and Chamo. I want to request with your permission as our distinguished moderator. Let's start with your country. Let's welcome the country representative from Cameroon.
Okay, sir. All the same here. The country representative for Cameroon. Our distinguished Didier Damasoso is around. He is a very, very dynamic, an expert mental health advocate and, professional. So you're welcome, Didier. The floor is yours. For the mental health reform progress in Cameroon, the challenges and some advocacy headlines this accelerated program can target. Thank you.
Thank you very much, convener, Dr. Zion. Thank you very much, Seraphine, and greetings to everyone. I'm very pleased to be here amongst you for this very important advocacy meeting. I'm called Didi Demasuso. I'm the country rep for AMHROA in Cameroon. I'm equally the executive director of Recorder, a mental health organization. I'm a clinical psychologist, a mental advocate, and mental expert. I would have loved to share my screen, but this morning my devices are really crazy, so I'm going to talk directly to you. So, Cameroon is one of the 54 countries that Africa has. It's located in West Central Africa and has a population of about 25 million persons. When we look at the Cameroon mental profile by the WHO 2020, in fact, in the World Mental Health Atlas 2020, we have key indicators which every country should eventually abide to when it comes to mental health. Cameroon is quite developing, as we can know, through a revolution that started in around 2015. And with respect to the indicators, key indicators are really booming. We have, for instance, governance and leadership, with a mental policy that was validated in 2016 and which has been implemented in some regards, but not all. And we are happy also that efforts are being put in place so that a mental legislation should be put forward. And what is also interesting with respect to mental legislation is that Cameroon ratified in 2022 or 21, if I'm not mistaken, the UN United Nations Convention for the Rights of Persons with Disability, which is a key element to support nations to be sensitive to the rights of persons living with disability, including mental disabilities. So, governance and leadership are key elements of the indicator of the Cameroon mental profile, but we also have mental promotion, which has been going on since 2015 with the Cameroon Days of Mental Health, which was the key element through which the Ministry of Public Health set forth to promote mental health in a very grandiose style. So mental health sensitization has been ongoing. However, with respect to these key indicators, there are a lot of things which need still to be reformed, improved, and one of the key elements is a need to engage as much as possible a variety of key stakeholders in the discussion, with a common language on where mental health has to be. There seems not to be yet a common language by all the mental stakeholders on what has to be done and for whom, especially that we are serving people who have a mental condition. It is important to note that 1 in 8 persons in the world is going to have a mental health condition. Therefore, mental health is everyone's business. So having to involve a multi-stakeholder perspective to discussions concerning mental health in Cameroon is essential, especially in a country which is culturally very sensitive in terms of how mental health is considered. Generally, like in most African countries, mental health is considered like witchcraft. People don't really understand what it's all about. So there is really needs to engage a variety of stakeholders. The next step also is trying to make mental health to be a key element of primary health care. This is essential because there is a disparity, or there is not a parity between mental health and physical health, and therefore not integrating mental health in primary health care will not enable access, free access, or to be candid, easy access to mental care services. And the services which are available are not used to the fullest. In fact, the 2 major services in the country, the 2 biggest towns, are not fully utilized because there isn't enough discussion, there isn't enough collaboration, there isn't enough partnership. All these are key to enabling mental health to be a part of primary health care. Equally, there is need to increase funding. Funding is essential to support mental promotion, to support mental prevention, to support a variety of activities which are necessary for persons to access the services. It is also important to say that there is need also to increase research, because without research, decision-making process cannot be effective. Our leaders need to know why they should take the decision for these persons, why they should take the decisions for these communities. And without research, it is going to be very difficult to enable our leaders, our decision makers to be capable of making informed decisions, informed healthcare decisions. So research is also a key element in Cameroon, which is not enough. And the available research is not used by those for whom the research is made for. Uh, there is quite a good number of initiatives presently since 2015. In fact, a lot of things have been ongoing with respect to research, but this research is not only enough, but it's not easily accessible. And this knowledge gap has to be filled. So in a nutshell, this is what we can say with respect to the mental profile in Cameroon. And we have to emphasize on the need for mental health care information to be religibly available in all communities and for everyone, because without this information, people are not going to be advocates, because to be true advocate, you need to be informed. Healthcare professionals are not going to perform their professional duties because they will not know what to do. Decision makers, policy makers will not know how to implement policies because they will not be informed. So in Cameroon, and I believe so in many other African countries, there is need for access to and availability of mental health care information. So I'm very pleased to be amongst you, and I'm very certain that we at AMHROA, we are going to move mental health in Africa to the highest level. Thank you very much.
Thank you very much, DJ, for that presentation. I don't know if it's my network that was breaking or the same for everyone. but I could get just a few points, and one of them is about indicators, because if we don't have well-defined indicators, we are not going to be able to track our progress. And again, we need research that is going to inform our leaders such that they can prioritize this agenda. And I quite remember during the mental health, the Africa CDC Mental Health Leadership Program in Nigeria, we were very much schooled on the economics of mental health, because those are the figures that our leaders, our political leaders, they understand. So if we're able to put this in terms of numbers, then it's going to convince them more. So we need research in order to do that. And again, I heard Didier, he mentioned the fact that mental health care information has to be available to the population, which is not the case. The population as well as the professionals. So please kindly feel free to just add to what I've just recalled. And we move to the next presenter. Dr. Zion, which country, please? So please kindly feel free to just add what I've just recalled. And recording in progress. Dr. Zion, which country?
Okay. Can you hear me very well now?
Yes, sir, I can hear you.
Oh,
Oh,
great.
great.
Great. All right.
All right.
So we
we
have
have
been
been
having some technical issues. A couple of our country representatives who are already lined up to make their presentations have been having joining.
So I have to just another device
to be able to join
at the time.
But I think that having
difficulties
joining.
Okay, so what now?
We're going to check
response and then comment
from participants. What is? But let me firstly appreciate our
Lydia for that
amazing presentation from Cameroon.
I want to ask
from your different countries, what is like mental health reforms?
What is like?
Do you have mental health policies? Do you have mental health legislations? Okay. What exactly is the story in your country? Please just share with us. We want to have this open conversation now.
Let's have this
section while we manage the other country representatives to get in. Please feel free and then our moderator will just identify you and you will have the floor. Thank you so much.
Yes, Didier.
Yes, thank you very much. As I said earlier, Cameroon is actually in a mental health revolution whereby a lot of things are being done with respect to mental health, even though a lot of things still have to be done. And among a lot of things which have been done is the validation of the mental policy in 2016 with considerable axes, about 10, which span from youth mental health, child, and passing by school mental health and a variety of other mental health interventions. So the policy document is there. However, its implementation is not the best because of structural barriers, because of financial barriers, and that is where we really need to work hard in AMHROA as a network and here in Cameroon to enable more awareness to be made or to be known on these aspects of the policy document. Also, in construction is the mental health legislation, which is being drafted, and it has already gone in a way whereby we have stakeholders who are already mobilized and who are working on it. So we're just very excited one day that we announced that the document is available. So these two documents are key elements of the mental health profile of every country, and Cameroon is really doing a great job. Nonetheless, what is really lacking, to my viewpoint, is an absence of common language for persons with lived experiences, because at the end of the day, what is important is that the persons who have a mental issue, those who have a mental issue should be cared. In fact, mental health services have to be drafted in such a way that these persons are being given the best treatment outcomes. However, there is a feeling that there is not a common language among the different mental stakeholders with respect to what has to be done. So service development and delivery with respect to mental care services is not the best. It's not the best, and there is no vision on respect to that. Because when you look at the technical plateau with respect to mental care in Cameroon, despite the fact that there are great numbers of health professionals and mental professionals in specific, 15 psychiatrists, about 250 psychologists, about 350 to 400 mental health nurses, but localized generally in big towns. Absence of mental health in primary health care. We see that in the long run, persons with lived experiences are not going to be provided with the care they need. So there is really need to have this common language, and that is the work we've been doing in our advocacy interventions in Cameroon for the past years, trying to be a sort of bridge amongst all these stakeholders so that they should first of all understand why mental health needs to be a priority in Cameroon and why they should work together and collaboratively. So we are trying to mobilize several stakeholders, several organizations in the AMHROA in Cameroon, so that we work collaboratively to push this discussion, this understanding, these collaborations, which is extremely necessary for mental health to be a common good, because at the end of the day, we want mental health to be common good. So the mental health profile is under construction, and it is exciting to see how this revolution is booming, because for the past 10 years, the mental health system in Cameroon has never been the way it is today. We are excited to keep pushing with the different chantiers or the different fields of activities which are on the ground. There's a lot of work being done in communities to enable people to be sensitive to mental issues, and the help of local NGOs is tremendous, because that is even where it starts. Local NGOs have been instrumental in pushing things forward, and we're excited in the AMHROA network based in Cameroon to see how we can foster more collaboration so that the mental profile should become more and more filled with positive indicators. Thank you very much.
Thank you so very much for that. So if you now look at it, you will agree with me that there are true, clear, open challenges, and the challenges are not only lying on having these legislations or reforms, but also in the implementation, and also strengthening local actors to be able to lead at their respective national or regional spaces. So let me still leave the question open. What can we do to drive implementation of policies and legislations? And for countries where there are no legislations or policies, what can we do? Okay. We have over 15 people who have sent in messages in our general group from different countries that are unable to join. I want to beg, please, Chamu, I want to beg. I want to end the meeting, but I will on it back in 2 minutes. I want to reset it so that we can accommodate all the other presenters. They have sent numerous messages on how they have been unable to join. So I guess maybe from the reset. In 2 minutes, please just hit your link back. Just hit your link and join back. And then we'll take up the conversation from these 2 questions. Thank you very much. Is that okay, please? Sophie? Ethel, is that okay? Cecilia, is that okay? Abel, is that okay? Please.
Yes, sir.
Thank you. Thank you very much. Thank you. Please, just in 2 minutes, just hit the button.